Greetings. This is Justin Allen, the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show, podcast dedicated to nurse practitioner entrepreneurism and achieving financial freedom, where I talk directly with nurse practitioners who need help. Listen up, our market is saturated. Jobs can be scarce. We are underpaid. We are undervalued. We are taken advantage of by the sharks within the healthcare system, and frankly, screw that. I'm sick of it, and it's time for a change. And listen, I'm here to help make that happen. We are powerful. We can forge a path where we are in control of our career and ultimately our financial and personal well-being. You do not need to submit to healthcare administrators and your doctor overlords. You do not have to take a measly salary. You do not have to work 50 to 60 hours a week. There is a different way, and I'm here to show you that path. This podcast is raw and unfiltered. I have not talked to the nurse practitioners in this podcast prior to the call outside of an email exchange to schedule the episode. What you're about to listen to is a consultation session between a nurse practitioner and myself. It is real, it is unscripted, it is unplanned, and I have no idea what we're going to talk about. Anything and everything can happen during our conversation. The nurse practitioners in these episodes are struggling with an issue in their professional or financial life, and they have reached out to me for help. My goal is to help the nurse practitioner with actionable advice that will enhance and improve their professional, business, and financial life. My other goal is to hopefully help my nurse practitioner sisters and brothers build a more productive, powerful, and free life. So I hope the content and information within these podcast episodes does just that. All right, onto the episode. Hello, everyone. Today we'll be talking to Sarah, who is an adult gero nurse practitioner. Currently, she's working at a skilled nursing facility, but also works bedside as an RN to supplement income and benefits. She's wanting to start a direct primary care practice that is delivered via the mobile and telemedicine route. She's wanting to test the waters with a low expense practice at first, and then eventually move into a brick and mortar practice. She's needing assistance with creating a low overhead practice and mustering the courage to start her own practice. Hey, Sarah, how are you?
I'm doing great, Justin. Thank you for having me.
Yeah, no, it's a pleasure to have you. So let's go ahead and get started. So just tell me a little bit about, yourself as a nurse practitioner, how long you've been, how long you've been practicing for and what kind of things you've been doing.
Great. So I've been a nurse practitioner for about 5 years now. I initially started in a traditional practice model, seeing anywhere adults to, end of life, 100 plus, and eventually moved to a Medicare Advantage type of setting. I did practice in that setting for about 3 years or so, and eventually moved to a whole different state and city. From an independent practice state to a non-independent practice state. So it brought its own challenges. Currently, I work in a skilled nursing facility. I'll be there 2 years now, coming this August, but quickly realizing that my skills could be better utilized in a different setting too. I'm not sure that I want to go back to an office practice either. So I'm looking to break out independently and set up a practice of my own to just maximize my impact and honestly see the benefits of my work in terms of income.
Sure. So this skilled nursing facility, is this a full-time job?
I mean, by the books, it is, but it is a productivity-based model. That naturally means that the productivity also depends on if people get admitted into the skilled nursing facility, right? So if they don't get admitted, you don't have the census to work with for the productivity. Yes.
Gotcha. Okay. And in terms of the production goes, do you find yourself is it lacking? I mean, is this job providing you an income that's satisfactory?
No,
not at all. Yeah. That's the give and take of a production-based model, right? Like you can make a lot of money if there's lots of patients to see, but if there really isn't, then, what do you do?
Absolutely.
So it's definitely a double-edged sword. Okay. And then you're working as an RN to bedside just to supplement some income?
I am doing that temporarily and for the benefits. Yes, I am. And it's been good to get back because I think it's sharpened up my skills. You find if you move from one practice setting to another, you kind of lose some basics. So I find that working in the skilled setting compared to what I was doing in primary care, it's quite different. And so getting back to the bedside has helped me just reignite the fundamentals and just kind of my passion for healthcare again, because I think I was beginning to get lost there.
Gotcha. Yeah, that can happen. I think that's kind of just part of the career, I think we just love and hate, love and hate, love and hate. It just goes up and down. Yeah. You get into some funks every once in a while. And, I kind of feel like I'm in one of those right now, to be honest with you. it happens. I think it's just kind of part of being in medicine in general and healthcare in general. I don't think we're designed to see this many sick people day in and day out. You know what I mean? Like it's just not natural. I mean, we've been on this planet for thousands and thousands of years, and only in the last 50 years has this kind of model really been present. You know what I mean? Just this conveyor belt of healthcare. It's just not natural. And so it slowly eats away your soul, I think, anyways.
Yeah, I can appreciate that. Thank you for saying that. I think, yeah, I knew that it was normal to go through the ups and downs because it happens all the time. Because I kind of do tell the bedside nurses, they're like, oh, it's better on the other side. And I say, you think? And so thanks for saying that. The funks, they're part of the journey. Got it.
It's just part of it, Yeah. So don't get down on yourself if you feel that way. I guarantee you anybody listening to this right now probably feels that way sometimes. Okay. Like, I don't think I've ever heard of anyone in healthcare that doesn't get burnout sometimes, So it's just part of it. Okay. So anyways, though, you want to start your own thing. So tell me kind of about, what your idea is here. You want to start like a direct primary care practice, a mobile primary care practice. Is this kind of what you're thinking?
Yes, I'm thinking about setting up, a mobile care practice, hopefully more leaning towards the telemedicine type of model. I purchased your course and I went through it and I kind of did like what you said is that initial visit is if you can see them first and then anything after that, you can do telemedicine if you need to. But in terms of, I guess, maximizing my payer source, a direct payer source sounds really good right now, but I'll do cash pay is what I'm looking to do. I live in a very small town in North Texas. So as far as my access to patient population is somewhat limited. We're growing rapidly, obviously, just because of where we are. So I'm looking to enter into the market just at the right time to be able to set up.
I got you. So mostly going to be telemedicine based.
Absolutely. I hope so, yes.
Telemedicine based, primary care, cash based. All right.
Yes.
So I'm going to give you a few things to consider here. All right.
Okay.
So first off, primary care is a very, very valuable service for, patients in this country. It is. Unfortunately, patients are somewhat entitled to it and they think their insurance should pay for it, and it should. So for people to pay cash for primary care, it's going to be a little bit difficult. All right. So just keep this in mind that you're not going to generate significant revenue for a little while. Okay. I don't know very many cash-based primary care practices that do very well. Okay. A lot of them just kind of come and go because, there's a lot of primary care offices out there that are accepting patients that will accept insurance. Now, I'm not saying it's not going to work. Okay. We actually had a podcast, I don't know, a month or two ago with a gentleman who owns a DPC practice that's doing very well, but he is in a very solid market. It's brick and mortar. Patients can come and see him, that sort of a thing. So it works for him. Doing it telemedicine, it's going to be very difficult for people to find you for that. All right. The internet's a very, very big place and you are a molecule in an ocean. Okay. Like it's so hard to get the word out for certain kinds of practices unless you have a lot of money to dump into marketing. Okay. And the return on investment on that marketing might not be worthwhile. I mean, if you set up a DPC program and charge, $80 a month or whatever, but it costs you $150 to, obtain that patient through marketing, it makes it difficult to turn a profit. All right. So keep this in mind as you do this. I'm just kind of giving you some pros and cons here. Like it can be difficult. Now, people don't really pay cash for primary care and acute care, sick visits and stuff like that because their insurance typically will cover that and they don't want to pay out of pocket. Okay. So just keep that in mind. You have to implement some sort of value driver into it. And by that, I mean something that's very, very valuable to patients. Like I said, primary care is important. It is valuable, but people don't perceive the value of primary care. They perceive the value of looking better, feeling better, that sort of a thing, like weight loss. Them losing 50 pounds is going to be more valuable to the patient than managing their blood pressure. It just is. That's how people work. Okay. So I just want you to keep this in mind here. Right. You live in a small town. Yes,
I do.
Okay. What's the landscape look like in this town in terms of primary care?
I would tell you in general, this little town that I stay in, I can't tell you the last census count what it was, but I know back in 2020 it was about maybe a little over 3,000, right? So there's 3 cities that are the closest to here. So I just clustered them kind of as my geographic area that I'm going to cover. So in this little specific area, the zip code that I'm in, they are 3 primary care clinics. They are all on the same street. One is like 2 feet away from the other, and the other was like 10 feet from the other. And so that's just interesting. And yet I did try to work for one of them. They sort of grew their patient population. The city is growing rapidly. So there's going to be massive opportunity. There's a big company that's moving here to the area. So the opportunity to build a patient population for yourself is there. I just am not ready to just open a location. And
Why?
so around the general area, then 2 of the other cities do have their own primary care, urgent care centers. So the opportunity is there to set up and get clients, but it's limited, like you're saying. Income wise, I think we're average in terms of income generation. So as far as people, are they concerned about how they look and feel? Of course they are, but more than other bigger cities, I don't think so. So I do value and see the need for niching. Maybe that's kind of maybe something we can talk about. Maybe you can help me think about it. I thought about functional medicine. Absolutely. Weight loss, as we're talking about, is something I can definitely add. So I think me calling it a primary care practice was just the easiest, lowest hanging fruit that I could come up with, just because I don't have the experience in terms of branding myself. I just kind of, this is what I already do. Maybe this would work, but I fully get the limitations of not having insurance and then having all the partnerships for testing and referrals and lab work. Primary care can be challenging if you don't have the right type of networks.
Right. Well, I guess let me ask you something real quick. I mean, that all makes sense and that definitely clarifies things. So why aren't you ready to open up a shop in town? Like, why do telemedicine versus a brick and mortar practice, or even do both? I mean, I think a hybrid practice works best. So that's why I'm wondering, like, why are you not ready for that?
I'm not quite ready for getting a location just because I didn't think that I have the resources to set up a shop.
Why?
Right. Immediately. Why don't I have the resources?
Yeah. Like, what do you mean by that?
Like, because you need a lot more money to be able to have a physical location. I have inquired into it. I'm looking into it. We also don't have too many business office opportunities available in the city is also what I'm finding out, but I am looking into it.
Gotcha. Okay. What's your budget like for starting a business? How much money do you have to put into this?
I'm looking to start at about $10,000.
Okay. That's all you need. All right. So listen, you could definitely start an office in person for $10,000. Easy. Okay. Easy. Like, I mean, you really could, like, very, very easily. All right. And you don't need anything crazy. I mean, if you can find just something that's 500 to 1,000 square foot, and throw some paint on the walls and make it at least look somewhat nice, like, that's all you need.
Did you say 500 square feet?
500 to 1,000 square feet is all you need.
1,000. Oh, wow. Okay.
Yeah, you don't need no more than that. Trust me. Okay. Like, you don't need like 3 or 4 exam rooms lined up in a hallway. You don't need to have a lab. You don't need all this stuff. Okay. It's not necessary for a little simple cash-based practice. Okay. If you have 2 or 3 rooms, you're ready. I mean, like, literally 2 or 3 rooms total, you're good to go. Okay. A little reception area, 1 exam room, 1 consultation room, 1 room for supplies, a bathroom. Like, that's all you need. All right. Get your mind out of traditional medicine where you walk in, there's 4 exam rooms, there's a chart hanging on the door for each one. You go in and out. No. Okay. A cash-based practice, you don't need to do any of that stuff. All right. You're seeing 1 patient at a time on your schedule. The next person's in the lobby waiting for you. When you're done, you walk out, you call them back, and you see them in your little consultation room. That's how I've done it at my men's health practice for years. My mental clinic, weight loss clinics. Other people listening to this right now are probably shaking their heads in agreement. Like, you don't need a crazy medical office. You don't. Okay. So I really want you to be thinking here more simplistic. All right. Yeah, because you really don't need all that stuff. I feel like that you could probably find a decent space in that town somewhere. If it's a small town, I bet you could find something cheap, $500 to $1,000 a month cheap. I bet.
Yes.
Okay. Yes. Yeah. Okay. And it doesn't need to be, like I said, it doesn't need to be beautiful. It doesn't need to be perfect. As long as it works, as long as it's decent, as long as there's not holes in the wall and some homeless person sleeping on the sidewalk in front, you're good. Okay.
I'll find a location.
Yeah. You should be able to find something. All right. Even though my first men's health clinic, there was homeless people sleeping on the sidewalk. We still made it work. Okay. Like, I mean, it was a dump, but it worked. Okay. So we moved out of there once we started getting busier. But yeah. So So listen, you can do this. All right. So I want you to kind of wrap your mind around here instead of just being telemedicine,
Okay.
being on like this shoestring budget, like you got $10,000, you live in a
Okay.
small town with no competition. I mean, you're ready. I feel like you're ready. You just got to figure out what it is that you want to do. So let's talk about that. All right.
Okay. Okay.
So primary care, sure. Okay. You could offer primary care, but you're going to need to offer some other stuff. All right.
Okay.
And
Okay.
so begin talking to people in town, begin doing some research. Is anyone else doing some of this niche stuff? Are they doing weight loss, HRT? Is there functional medicine? Like, is there anyone in town doing any of this stuff?
They are doing it just at a very small scale. I think their heavy payer source is the insurance companies, of course. They're just offering the HRT weight loss program. I'm not sure. Yeah, maybe one person I think does a component of functional medicine. The competitor that I looked up, so he does a little bit of that.
Is there a standalone wellness practice in this town?
Absolutely not. Not
okay.
within
So then that's
20 miles that I know of.
Okay, so then that's what you do. Okay, you open up a standalone wellness practice. All right.
Okay.
So yeah, like standalone wellness practice. That's going to be your focus here. Because listen, when you are determining what kind of practice to start, what services to offer, you deliver what's needed. Okay. You let the world tell you what they want, not the other way around. You don't tell the world what they need.
Okay.
You let the world tell you what they need. Okay. You don't tell them. It doesn't work that way. That's a recipe for a business that's going to fail. So just, look at what the need is. And if there isn't a wellness center in town,
no.
Okay, then I say you do something like that.
Okay.
You can do some primary care out of that. That's fine. That's fine. I wouldn't make that your focus though. I would make your focus some of these niche things like weight loss, HRT, nutritional counseling, vitamins, et cetera. Okay. That's what I would focus on. And you don't need to offer them all at one time. Okay. You can kind of tier it in. You can do it over a period of time. You don't need to do it all at one time. Okay. Pick 2 or 3 services, learn how to do those services and just get it done.
Okay.
Learning weight loss is pretty straightforward. There's really not much to it. All right.
Yes.
HRT in general, it can be complicated, but it can also be simplified. All right. So it's really not that difficult to learn. Right. Those 2 services are going to be your bread and butter. And then some other things, like if you want to do a little functional medicine into it, I mean, functional medicine is more of a way to, look at the patient. It's more of a treatment principle, right? That's more of a mindset shift. But I mean, you could learn that too and begin integrating that into your practice as well later on, But I'd say pick 2 or 3 services: weight loss, HRT, services that, patients, see you on a fairly regular basis, long-term. That's a profitable business model. You don't want to see patients one time and that's done kind of a thing. You don't make money that way.
Okay.
Yeah.
Got it.
Has to be recurrent patients. You see them often and they stay with you long-term.
Okay.
All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all elite nurse practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and that other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode. I think that's what you need to do. I think that's
I love it. It's on my mind. So you're confirming what I was working with and trying to do. Just recently been working to just think about niching and kind of exactly how I can branch myself out. And I do enjoy weight loss and I do enjoy, like just a more comprehensive approach. And like you said, it's interesting that you say functional medicine is more like a treatment principle. I do like that principle to balance it out, obviously. Pills are a great place for the traditional pharmacologic treatment. Of course, then there's a place for the other things too. So I want to be the person that's kind of bringing both.
Yeah, you can absolutely do both. That's fine, and it allows you to avoid insurance. You don't have to deal with all that.
I'm nervous about insurance, to be honest with you. To me, I mean, especially the writing backs, if you get denials, I'm thinking about how much more work.
Yeah.
Eventually it'll come. Maybe I hope it doesn't. And I think niching is the way for me to permanently avoid
That it
insurance.
is. It
Okay.
is the way to avoid insurance. Yeah. Yeah. Deal with all the pre-auths and all of them taking money away from you, not paying you, you chasing it down. You don't want to deal with it. I'm telling you, you just don't want to. Maybe at some point in the future, but I'll tell you what, if you open a cash-based practice and start to do well, you'll never consider insurance ever again.
Yeah, that's the hope.
Yeah, you just won't. Okay. If the population of this town was three or 4,000 people, 3 years ago, and you said it's growing rapidly, and it's probably up to 4,000 or 5,000, I would imagine at this point, maybe
So that
more.
was 10 years. The last census I think was more towards the 10. I mean,
Well, then, yeah, you probably got double that at this point. So that plus the other small towns around you, trust me, there's at least 50 to 100 people within a 30-minute drive of you that are willing to pay you cash for this stuff. I can guarantee that.
Great. I like that.
Okay. Yeah, I guarantee it. Okay. So don't worry too much about this whole, everyone around here has insurance and Medicaid. No one can pay cash. That's a bunch of nonsense. Okay. Trust me, there are people who will pay you cash.
Good to know that. Yeah. And I think if that's all you know is insurance and working in a traditional employee setting, it's pretty daunting to think out of the box. So I appreciate you having me on today to discuss the possibilities specifically to me. So
yeah, for sure. When you're in an insurance-based practice and that's all you know, it's hard to know anything else, and so that's kind of why Elite MP is here. I'm just going to show you a different way, right? So there's a different model out there and it works. Okay.
Great.
There's a lot of healthcare is going towards cash-based models all around the country for all kinds of different things. Okay. Here's even some surgeons who are just cash-based only, kind of concierge surgery or whatever, and they charge an affordable rate. And a lot of people just do it because they don't want to fool with their insurance and get these huge hospital bills and stuff, So It's kind of moving in that direction in a way because people are sick and tired of the insurance scam. They just are.
Yeah, I encountered that a lot. So that's good. That's good to know. Okay.
Yeah.
So thinking about setting it up. Yeah, the value drivers for sure. I think I'll definitely look to getting weight loss and HRT. And I know you do offer courses in that lane. You think I would be pretty confident to get out the gate just completing the HRT one? I think for me, that would be the one that I'm maybe not so confident in.
Yeah, for sure. It's a good starting place. It'll teach you the business aspects and the clinical aspects of it, there's always going to be, additional learning necessary for all kinds of different things, right? But overall, it's going to provide you that foundation you're going to need. Okay.
Great.
And then, through experience, seeing patients, you just learn as you go for a lot of things. You actually are in it. You see patients, you see the lab work, you see the side effects, you see the improvements. It's one of those things that you kind of learn as you go. But the good news is that it's pretty safe. It's pretty low liability. As long as you follow just the basics, the dosing recommendations, things like that. As long as you do those kinds of things and you're following up with the patient on a regular basis, very little can go wrong.
Yeah. I mean, of course, that you have to have the other business considerations like insurance and stuff. Okay. Yeah, I'm listening to what you're saying. So Justin, let me ask you another question regarding that. I'm not necessarily confident in drawing labs. Is that something that somebody like me should be nervous about in considering? We don't really have too many, of course, clinical services like that I have an easy lab location. I think they're within 20 minutes to the next big city that can get them drawn. So would you think that would be a big turn away if I wasn't drawing my own labs?
Nah, it's okay.
Okay.
It's not that big of a deal. Okay, listen, patients do like the convenience if you can draw labs in your practice. Okay. They like that convenience. I don't blame them. I don't want to drive to a lab and get labs done, So don't worry about that. If you use Access Medical Labs, if you go to the Elite MP website and click discount labs under the practice services tab, if you just sign up an account with Access Medical Labs, it's cash-based. You can draw it in your clinic. UPS just picks up the labs and it just gets shipped and you're done. Do it anywhere. As long as UPS comes, as long as UPS is available in your town, you should be okay.
Okay.
Yeah. So you could do that. And if they want to use their insurance for blood work, if you give them that option, okay, we can't draw it in clinic because we don't do that. here's a lab order, go over to, wherever, go to the hospital, get your blood work done, or drive to this other town, go to Quest or whatever.
Yeah. Yeah. Okay.
Yeah.
So, thanks. That's kind of why I wanted to talk to you. I knew you'd kind of put some sense into me in terms of, because you get nervous about the little stuff,
Right.
Yeah, I'm pretty,
Well,
I mean, I know I can get the marketing out of the way. I was just thinking about like things like labs and then of course I'm thinking about that hefty collaborative fee that you have to pay somebody. Oh my goodness, Justin.
Yeah. I mean, in Texas, you're going to just budget $500,000 a month for a doctor. You just got to budget for it. It just is what it is.
It is. Yeah, absolutely.
Yeah, there's really no way around that. Yeah. But, a lot of these little things, I mean, a lot of it's just very, very simple things. Like it's really not that big of a deal. The key is figure out what you got to do to get patients in the door, basically. All the other stuff is just background noise. Like you can learn it as you go, like the first order we sent from a compounding pharmacy, and it was the first time we ever did it on our first patient. It was just like, navigating it was stressful. So one thing that you can do is you have like little drills before you open up. You basically walk through the patient experience without a patient there. Like, okay, I see a patient, I document it. Okay, then what do I do? Oh, okay, I'm gonna have to order some labs. Okay, let me figure out how I'm gonna do that process. Okay, I'm gonna order a medication from a compounding pharmacy. Let me figure out that process. Like you just walk through those scenarios, a week before you open, and you work out those kinks before you first see the first patient. Like that's kind of the first starting point, right? You just go through those scenarios in your mind and you just write it down on paper, go into the EMR, go into the ordering systems and like practice. And then when it happens, you've already done it multiple times in pretend world, but you understand how to do it. Does that make sense?
That makes perfect sense. And I do have a follow-up question whenever you.
Yep.
Yeah. As far as documentation for a cash pay practice, I know there's tons of, you offer advice regarding that, tons of like low cost EMR types of systems. If I'm not going to be billing insurance right off the gate, should I get, let's say I kind of have fallen in love with the idea of Athena just because it's comprehensive, it's one, but I don't know that it makes sense for a small practice starting out. But then I figure, I guess it would be nice to have the data in one place rather than migrating. And I know data migration is, it can be done. So I'm not too nervous about that. But let's say versus getting Careo, just an example of, let's say Careo is maybe, what are your thoughts there regarding like an EMR? If you're doing cash pay, should you go for all the bells and whistles?
For an EMR?
Yes.
No.
If you're doing cash pay?
No. You can paper chart if you want.
Okay. Okay.
Do not spend a lot of money on an EMR, okay? Like, it is not that important. It's really not. It doesn't affect how the patient's treated. It doesn't really affect how you collect money. Like, it's not that important. It's just for documenting, Think of it that way. Like, remember, you're not submitting bills to insurance. The charts don't have to be perfect. They don't have to have this many reviews a system. They don't have to have this timestamp on it. It doesn't need any of that nonsense. All that stuff is for insurance. When it's cash-based, you just write a note. You could use Microsoft Word and save the notes in a Google Drive if you wanted to.
Okay, I got it.
You could if you wanted to. Like, you know what I mean? Just go with an EMR. It's $50 to $100 a month and be done with it. We go over all those EMR suggestions in the course. But like you could use like Simple Practice, OptiMantra, Chart EHR. They're simple EMRs and they're fairly cheap.
Yeah, I do have the house calls and telemedicine course. So I've gotten a lot of that information from there already. So thank you so much that's kind of helped me get a head start and figure out what we're going to do. I appreciate that. And I think that's just about the questions that I do have, especially if I'm going to do like a niche type practice. And of course, like I said earlier, the primary care practice, I wouldn't be looking to get the really complicated patients because they typically carry insurance. So that was my thought is working with community partnerships, I guess, to collaborate and things like referrals and all that stuff in terms of networking. That was something that I'm going to look to grow into.
Yeah, just grow into it. Exactly.
Okay, great.
Grow into it. Your goal right now is to get people through that door and start generating income. That's your goal.
Okay.
How do you do that? That's your goal. Okay. Perfect. Then you can start building from there. Because once you have that income from the business coming in, it gives you that dry powder to use to grow the practice.
Okay. That's great. That's great to know.
Well, this was straight to the point. I love this. This is a great episode. Straight to the point. Boom. Like you got what you needed. Yeah. So, well, I mean, if you listened to them before, I like to end the episode with you asking me a question, anything you've ever been curious about my life or my career or my business or anything.
so much. Well, first, I should say a big thank you. You've been like invaluable. I mean, you give me so much value. You're pretty responsive to emails. You're pretty responsive and you offer us a ton of resources. And I dare say there's nobody out there quite like you in terms of you offering, yeah, of course you charge for your courses, which you should, and for the resources that you provide for us, but you offer us a lot of free value too. So I guess with everything that you're doing, and I did read, I think someplace you talked about balancing your life in terms of all the things that you're doing. Can you speak to it? Obviously now, since you wrote that article, I think maybe it was last year, you talked about balancing your life and kind of figuring out what works. Yep. And dealing with sort of burnout, which that's funny because it's circling back to what we spoke about earlier. Now that you're even much busier, can you talk to me about how you are managing?
Well, listen, surprisingly, I'm not busier because I've developed systems and processes in my life that work for me. Okay. Getting to that point was hell. That took a lot of work. Okay. What happens when you develop a business? Multiple businesses too, and especially when you start systemizing it to the point where, you have other nurse practitioners seeing patients for you, automated processes, things like that. What happens is you begin making more money and you work less.
Okay.
Because you're not doing the day-to-day work anymore, right? But finding that balance up to that point was difficult. Like now I feel much more balanced because I'm not doing so much day-to-day work, okay? But finding that balance was difficult. And the way I found it was prioritizing income and prioritizing really what lit the fire for me. You know what I mean? The urgent care, for example, I was still working urgent care up to, a year and a half ago, I think, about now.
Okay.
Yeah, I was working urgent care up to a year and a half ago while I started Elite MP, my men's health clinic, my medical cannabis clinic, the telemedicine HRT products that I ended up selling. Like I started all these things, rental properties, property management. I started all this stuff while I was still working full-time at an urgent care. And then I dropped that at part-time, I was still doing that all. There was no balance. None, zero. Okay. And so I prioritized income and I prioritized what actually did it for me. Urgent care was not doing it for me anymore. And the income from it really was not doing it. It wasn't moving any mountains in my life. It wasn't changing anything. You know what I mean? So I was like, I cut it out. When I cut that out, more balance came. Right.
Okay.
Men's health. I was seeing more and more patients. I was starting to like make it into more of a job, and I didn't want it to become a job for me. So I hired more nurse practitioners to see more of the new patients for me. Now I got more balance. Right. So I cut things out while prioritizing what was making me money and what I really enjoyed doing. And like Elite MP, for example, writing the articles, recording this podcast with you right now. This is what lights the fire for me. And so this doesn't feel like work. And so there's balance, right? Does that make sense?
That makes sense. Thank you so much. Thank you so much.
No, you're welcome. Okay, cool. Well, anyways, like I said, this was a great episode. If you ever want to do a follow-up, let me know. I'd like to find out how the progress is going. And yeah, great. So you got my email if you have any other questions, okay?
Okay, great. Thank you so much, Justin. It's been wonderful. Thank you for the clarification and insight. I definitely feel like my questions are answered. I'm definitely, I would say, empowered to kind of shift out of thinking about just doing the mobile telemedicine and just really opening up, because if my goal is to be on ground, I guess the sooner the better for me.
Yeah. Pleasure to help. We're recording this on a Friday, so have a good weekend and let me know if you need anything else, okay?
Thank you so much, Justin. You have a blessed week.
All right, take care. Bye.
Bye.
All right, I hope everyone enjoyed the episode with Sarah. That was a straight to the point episode. Like she had her questions and she just took the advice and we just went straight through it. That was a great episode full of all kinds of good nuggets there. So, I've said this before in other episodes, like you got to be willing to pivot, okay? You got to be willing to meet the demand in your area. You got to let the world tell you what they want, what they need, okay? You can't tell them what they need. That doesn't work that way. So when you are deciding to start a practice, when you are deciding to grow your current practice, all right, you should be integrating other services into it, other products. That's kind of one way that you grow your business, right? You bring in additional revenue streams, but you gotta make sure that it's something that your patients want, okay? Listen to your patients, listen to them. What do they need? What do they want? Give it to them. If you're in the startup phase and you don't have patients, you can't listen to them, look online. Do a Google search. Is there a weight loss clinic in town? Is there an IV infusion clinic in town? Is there a ketamine infusion clinic in town? Whatever, right? If it's not there, I can tell you right now there's going to be a need. People are people. It doesn't matter where you are at. They want these services. They want affordable, convenient care that brings value into their life. Doesn't matter if you are in a town of 3,000 to 5,000 people like Sarah, or if you're in a town of 1 million people. It doesn't matter. People want these services. So deliver it to them. All right. Hope everyone enjoyed this episode. Talk to you guys later. Thanks. Bye. Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and/or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcast. The content in this podcast is copyrighted by Galaxy Medical Southwest 2023 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.